So thank you everybody for being here today for an important announcement. And we have two people. Dr. Levine is with me, and we have Dr. David Rubin, who's going to be on too. On TV soon. So let me start. During the past week, we have seen an unsettling climb in new COVID-19 cases throughout Pennsylvania. During the past week, that has especially been bad. When we hit our peak on April 9th, we had nearly 2,000 new cases that day, with other cases hovering around 1,000. That was our peak, 2,000. Medical experts looking at our current trajectory are projecting that a new surge is in the offing. And what we're seeing right now could soon be even worse than what we saw before. We had 994 cases just yesterday in Pennsylvania. So before, we succeeded at flattening the curve back in the spring. And we did that by working together, all of us. And we actually broke transmission links. So we got down to the point where we were actually in the 300 to 400 new cases per day. And Pennsylvania, as I recall, was one of the continues to be, but still was one of the best states in the country when it came to dealing with the COVID virus. We didn't know as much about the virus then as we do now, so we had to take a broad approach, sort of the blunt instrument approach to eliminating points of contact. But with our current rapid increases, we need to act again, but this time we have more knowledge and we can act in a more focused manner because we have a better sense of how this virus is affecting Pennsylvanians. Through contact tracing, we've identified 3 catalysts for our case increases. This is where we think the case increases are coming from. First, some Pennsylvanians have been ignoring the mask-wearing requirements and social distancing when they're visiting Pennsylvania bars and restaurants. They are unknowingly spreading or unknowingly picking up the virus. And this carelessness has resulted in pockets of super spreading. Second is out-of-state travel, both by Pennsylvanians who are returning from places they visited out of state and by out-of-state folks coming to Pennsylvania to visit us here. And the third catalyst for this new upsurge is a lack of national coordination. And that has resulted in states in the South and Southwest especially not committing to the things they should have done to keep this virus from spreading. Unfortunately, this virus does not respect state boundaries. And so we are paying the price in different ways for what states and other places have not done. We see that, for example, in testing. Sometimes takes as many as 10 days to get test results back. And that's not because of anything we've done. It's because national test places are being overwhelmed by the cases that they've seen in these other states. We're paying the price. We did everything we should have done. We were responsible, and yet we're paying a price right now. So the result is that other states have become petri dishes for COVID-19 during the time when we were all working hard here in Pennsylvania to suppress the spread. Some of these states actually now have hospitals at maximum capacity due to the COVID-19. And this virus knows no boundaries, no borders, as I said, so it's been spreading northward and eastward across the country and has reached our Commonwealth once again, this time from the west, the south, and the southwest. Together, these 3 catalysts have turned our downward trend into an alarming escalation. And we're already at a tipping point where we really have to act. We don't want to become Florida. We don't want to become Texas. We don't want to become Arizona. We have got to act now. So today I'm going to be signing an executive order that will implement the following mitigation efforts across Pennsylvania. First, restaurants will reduce their indoor capacity to 25%. The current outdoor dining rules remain in effect just as they are. Second, on-premises alcohol consumption will be limited to service with meals only. Cocktails to go and carry-out beverages are allowed. Third, telework must be implemented whenever possible. And fourth, indoor gatherings will be limited to 25 people, and outdoor gatherings remain at a maximum of 250 people. As I've said, we are using the information we have gathered over the past few months to create these mitigation efforts based on how the virus spreads, how it's spreading in actuality right now in Pennsylvania. We know that the virus appears to be primarily airborne, so we're placing more limits on indoor activities. We know that the virus spreads rapidly in crowds, so we're limiting crowd sizes in situations where people are likely to gather close together, such as bars. This is the virus speaking. The virus is making the rules here. We're just trying to anticipate what those rules are and doing what we can to reduce the risk that virus is going to do a lot of damage in Pennsylvania. Now, these new mitigation efforts are in addition to existing actions. They don't take away the importance of our personal responsibility to do our part, each of us, 13 million Pennsylvanians, to reduce the possibility that we are spreading COVID-19. That includes wearing a mask when we're out in public. It includes washing our hands, using hand sanitizer frequently. It includes social distancing as much as possible. We have seen these efforts work during the first wave in the spring. They worked, and they're going to work again if we all do our part. So I want to say thanks to every Pennsylvanian for your continued patience and your support. I know all of us, I am and you are, eager to get back to life as normal. That's the way it goes. But this is what we have to do. It may feel like a step backwards, but it isn't. It's just a reminder that we need to get back on the course of mask wearing, social distancing, and successfully mitigating COVID-19. Pennsylvanians should consider that even with indoor dining limited and bars closed for on-premises alcohol consumption, cocktails to go are still permitted, and there is no shortage of outdoor dining options. Small gatherings of friends in the backyard or at a local park, they're still permitted. And children and families are encouraged to responsibly take advantage of one or more of the 121 Pennsylvania state parks or other outdoor local and local fitness options. Children can visit local playgrounds, community pools. They can enjoy outdoor activities with their families. Gyms and fitness centers can remain open and are encouraged to offer more outdoor fitness options. I want people to spend time together, but I want them to do so while they're practicing social distancing, while they're wearing masks when required. When you leave your home and you're not participating in an outdoor fitness exercise, wear a mask. Every minute that passes is 1 minute closer to the end of this pandemic. That's what we're trying to achieve. And many researchers and many medical professionals are working diligently to find more treatments, maybe a vaccine, maybe a cure for COVID-19. So thank you, Pennsylvania, for everything that you've done, every sacrifice you've made. Let's keep working together. Let's keep working together as I know we can to protect ourselves, our families, our friends, our businesses, and our communities from a further spread of COVID-19. Now I'm going to turn things over to Secretary Dr. Rachel Levine. Secretary Levine.
Good afternoon. Thank you, Governor, and thank you for your leadership and support. Here is our latest update on COVID-19 in Pennsylvania. As of 12 a.m. this morning, we have 994 new cases of COVID-19 being reported, and this brings our statewide total to 97,665 Pennsylvanians who have tested positive for COVID-19 in all 67 counties. Tragically, 6,957 deaths have been attributed to COVID-19 now in Pennsylvania. As I explained on Monday, we have seen case counts increase in 43 counties in Pennsylvania, and the percent positivity rate has increased in 28 counties over a 7-day period. Over the last day, we have recorded our single highest day in tests being completed, with more than 28,000 test results reported. Currently, we have a total of 649 trained contact tracers across the state, including our community health nurses, local municipal health departments, and our committed volunteers. And we're working to increase that every day and every week. Through all of these efforts, we are still seeing alarming increases in cases of COVID-19 in 19 to 24-year-olds throughout Pennsylvania and in 25 to 49-year-olds in Pennsylvania. The actions that the governor and I are taking today are designed to be surgical and precise to prevent repeating the cycle that we saw in the spring. As the governor mentioned, we have gained a great deal of experience since the start of this outbreak and have learned from best practices from other states and counties in Pennsylvania. New York and New Jersey, as well as Allegheny and Philadelphia counties, have taken a similar approach. In addition, states like Texas, Arizona, Florida, and California in the past have not taken this approach and are now seeing the surges. This action is necessary now to stop the spread of COVID-19 and stop the disease transmission cycle from repeating. We know what will happen if we hold fast and wait until cases rise exponentially before taking action. The numbers would continue to increase and our entire state would then potentially have to quarantine. And so by acting now and making these specific and targeted mitigation efforts statewide, we can get ahead of the curve and ensure that not only will our hospitals and healthcare system be available to patients, but that our economy will survive while still saving lives. There are things that you can do right now to stop this cycle. First, wear a mask. Really, if you're thinking that you might need to wear a mask, don't think so hard. Wear the mask. If you're in a store where people are not following the mandatory mask order, make a choice to leave. If you're getting together with people who've been pretty vocal about not changing their lifestyle and are refusing to wear a mask, make a choice not to see them. As much as our efforts are about laws and mandates and orders for safety, they're also about your choices. Pennsylvanians want to be at work. Pennsylvanian children want to go back to school. But it is our actions as a community that will impact our ability and their ability to do those things. So be safe. Adapt your activities to protect against COVID-19, and please wear a mask. Here are my daily reminders. Please wash your hands with soap and water for at least 20 seconds, or the time it takes to sing Happy Birthday twice. Please use hand sanitizer if soap and water are not available. Cover any coughs or sneezes with your elbow, not with your hands. And please don't touch your face, especially after touching surfaces. Clean surfaces frequently. And if you have to go out, please wear a mask if you're going to come into contact with others. If you have questions about your health, please contact your healthcare provider. If you need mental health resources because you or someone you know is experiencing a mental health crisis, please contact the crisis text line by texting PA to 741-741 or call the statewide support and referral helpline at 1-855-284-2494. Again, 1-855-284-2494. If you or someone you care about needs help with a substance use disorder, please call the Department of Drug and Alcohol Programs Get Help Now hotline at 1-800-662-HELP. Again, 1-800-662-HELP. For the most reliable information related to Pennsylvania's response, please visit our website at health.pa.gov. And what is most important for Pennsylvanians to now remember is stay calm, stay alert, and stay safe. And now it is my pleasure to introduce Dr. David Rubin. Dr. Rubin is a pediatrician. He is director of the CHOP Policy Lab and director of Population Health Innovation at the Children's Hospital of Philadelphia. Dr. Rubin.
Governor Wolf, Secretary Levine, thank you for having me today. As the director of our policy lab and our population health program for health system at the Children's Hospital of Philadelphia that sees over 600,000 children and adolescents every year, our teams mobilized very quickly in March and April to begin developing local area forecasts at the county level, because even though it was extremely important that we have national and state data that really impressed upon our communities the magnitude of what was coming, it was also important, we foresaw, that we would need to develop local area knowledge so that we could get areas opened as soon as possible and as safely as possible. At CHOP, we represent the interests of working families. We knew that our families would be facing the direct impacts of COVID, particularly to caregivers. We have a lot of grandparents throughout the state, that our teachers and our staff within the schools would be thinking about their own risks, and that children did not live in a vacuum. And as much as we knew that we needed to get families back to work and children to schools, we also recognized that we had to do it as safely as possible. The models that we have now developed, which forecast the disease activity and particularly the viral activity throughout over 500 counties in the United States, and which can be found at policylab.chop.edu, along with other resources for families, have actually allowed us to understand how this virus moves across the country and how it sometimes and often spares rural areas, and even as we struggle in some of our more urban areas. The modeling has also helped early on. We were one of the centers that were really trying to challenge state governments to reopen some areas safely that were ready, even as our cities remained more cautious and were struggling with disease activity in their local areas. Our models now have been helpful to the White House Coronavirus Task Force as we've been helping them to understand potential impacts of stronger mitigation strategies to try to curb this next wave of the epidemic that has been sweeping the country. And so for a long time, we've helped advise and consult to both state and national leadership to help people make important decisions that affect the lives of people every day. But we also promised that we'd be back if we saw incontrovertible evidence that the resurgence was coming. And sadly enough, I'm here today to let people know that that evidence is now extremely clear. And even as we focus on Texas, Arizona, Florida, and other areas of the Southeast and Southwest, it is very clear that the disease resurgence is moving quickly into the Northeast region and to the upper Midwest. And if I can share my screen, I'm going to show you exactly how we don't rely on single pieces of information to make that assessment, but we see it through neighboring regions. We see it in multiple counties sharing the same disease resurgence, and we see it in our testing positivity rates, as Secretary Levine has discussed. The goal here, I would remind everyone, the goal here is we have about 6 weeks left in summer, and all of our school reopening plans, of which our teams at CHOP have been very much involved, are entirely dependent on us keeping disease transmission down so that we instill in our public the confidence that they can safely put their children on a school bus and return to school, and that our teachers and our staff can feel that they will be safe when they go to educate our children. So with that, I'm going to try to share my screen, and if I can't, I'll give you the general comments, and I'm going to start by focusing in on Allegheny County. So I'm going to assume that that people in the room can see what I am sharing now on the screen. Is that correct? Lacking someone tell me otherwise, I'm just going to start preparing my comments. The
No,
graphs that
we just see you.
Oh, you just see me, so you can't see my screen. Let me try. So I don't think this is going to work on the screen here, so I will just contextualize the comments. Over the last couple of weeks, we've seen significant disease resurgence in the Pittsburgh area, not just in Allegheny County, but in the neighboring counties around them. We have applauded as we've watched people in the Pittsburgh area begin to distance more and do a lot of the individual activities that Dr. Levine has spoken about today. and they may in fact be curbing the epidemic that is quickly spreading there. However, this was not an isolated outbreak. Prior to the resurgence in the Pittsburgh area, we've seen multiple cities now in the state of Ohio, including Cleveland, including Columbus, Ohio, with significant resurgence that continues to climb. They have widespread community transmission, which is washing over our western border of Pennsylvania in waves, particularly as people travel in a season of American vacations. And if that were only the case, we would have enough to be concerned about what was coming east. But even more worrisome now is a lot of the pressure from the south is really moving quickly up the I-95 corridor. We're seeing increased disease transmission in the Washington, D.C. metro area, in the Baltimore, Maryland area. Those areas just a couple weeks ago looked much more like us or New England, where it was fairly quiet. And within a couple of weeks, they now resemble more like the cities in North Carolina that have lost control of the epidemic. For people to view on our website, the Virginia Beach projection for the next 4 weeks, we'll see what epidemic transmission looks like and how quickly cases can grow within a region. Over the last week or two, we've now also been watching very closely the Philadelphia area, and it is very certain over multiple weeks that the collar counties and the surrounding counties in southern Jersey are all now reflecting increased diseased activity and are conferring risk as well to Philadelphia proper. This last week or two, we've seen elevated transmission rates throughout the Philadelphia area, and we're seeing very clear evidence of increasing case identification in Philadelphia. This is also not isolated to just Philadelphia and to Pittsburgh as well. Because of the increased risk now and transmission we're seeing throughout the state of Maryland, up the Route 15 corridor towards Harrisburg, we are now seeing significant pressure on York County and into central Pennsylvania. Simply stated, we are seeing now widespread community transmission throughout the Northeast area. It's also extending up into northern New Jersey as well. And it's of sufficient concern now that if we do not act decisively in these next 6 weeks, we may not be in the favorable terrain we had hoped to be in to be able to convince the public and to assure the public that opening schools will be safe after Labor Day. Make no mistake, the time is now for action. And I'm going to hand back the decisions and the questioning back to Governor Wolf, to Secretary Levine, and I thank them for having me here today. I'd be happy to answer your questions as well.
Questions? Yes.
So, why is this a statewide order after you previously stated that you were going to take a more targeted approach to counties that were seeing increase in cases? Obviously, the more rural counties are not seeing the same influx in cases. Why are those businesses being forced to occupy with the same limits as businesses in larger counties with more cases?
Okay, first of all, this is a very targeted approach because we know more about the disease, because we have contact tracing. We know where this disease is spreading from. We also know that the disease is not respecting boundaries, county, state, national boundaries. So we are trying to do what we need to do in a targeted fashion. As for the geographic spread, most of the counties in Pennsylvania actually are seeing an increase, not to the extent that Allegheny County or Philadelphia County, but this is something that extends across the Commonwealth. But as Dr. Rubin and Dr. Levine said, we're trying to make sure that we do things we need to do right now so that when schools it comes time to open, we get back to the fall, that we're in a position to do that. Again, we're trying to follow the dictate of this virus, and this virus is saying, I'm back. And you might have done everything you needed to do in Pennsylvania, but you couldn't control what happens in these other states. You couldn't control who's going to be going across your state borders. You couldn't control who's going to congregate in bars. I don't like this any more than anybody else does, but this is what we're trying to do. This is what we need to do if we want to stop this in its tracks right now, so that by the time we get to the opening of schools, we can do that. I don't know, Dr. Rubin or Dr. Levine, you want to say anything?
Well, to echo the governor's comments, I think that, and the data that Dr. Rubin is presenting, I think the threat is statewide. And so that is why this is a statewide effort. And as the governor said, this is a targeted mitigation effort. This is not red, yellow, green, where many, many different segments of the population were affected. We're really looking at the data, not only in Pennsylvania, but the data nationally, is that the virus is starting in younger people, so the 19 to 24 age group, but also the 24 to 49 age group, and that is particularly being spread, and sometimes in these super spreader events, in restaurants, in bars where people are not practicing social distancing, they're not masking, and they're putting themselves and their families and the community at risk. And that's what we've been seeing in Allegheny County. We've had extensive discussions with Dr. Bogan, have strongly supported the mitigation efforts that Dr. Bogan has put in place, strongly supported the mitigation efforts that Dr. Farley in Philadelphia has continued, actually, over the last number of weeks. And I just want to contrast the efforts that Governor Wolf's leadership is taking in the administration to Florida. Because in Florida, you can see what happens when you don't do any mitigation efforts and you basically let the virus burn. And so they are seeing, last week was, Saturday was over 15,000 cases. Yesterday, I think it was over 10 or 11,000, close to 10,000 today. You can see that their hospitals are threatened in many different areas around the state. Their death rate is now increasing. That's what happens when you just let this burn. We cannot be Florida.
If I could just follow up, what if this, people are going to be asking, I'm sure, what if this doesn't work? What if we don't get to where we want to be? Are we going to see more businesses affected or an occupancy limit, brought down further? Because many of these restaurants will say, we can't survive at 25% occupancy.
So it is absolutely, and the governor can speak about this as well, extremely challenging for those businesses and for the people and the employees and the owners of those businesses, and we certainly realize that. But this is where the virus is spreading now, and this is where we have to take action. It's hard for me to predict what we're going to do in the future. We are positive and optimistic that this action will be successful, but we cannot be Florida. We will not let the state go to be Florida and letting it burn, and so we'll do whatever is necessary, but this is what is necessary now. Governor?
I couldn't agree more. I keep saying, this whole process, we've had an array of choices, and they've all been bad. What we've been given is what the decision as to what's the less bad option. Clearly, this is a bad thing for the businesses we're targeting here. The question is, would we be in even a worse position if we allowed what happens in Florida, where no one's going to restaurants, they're not going to bars anymore, and as long as the hospitals are being overwhelmed, they're not recovering from the disease. I mean, none of those things is good for any part of any economy. We're trying to mitigate, and yes, it's focused and targeted right now. It's a bad thing. Let's hope we do this and get through this phase as quickly as possible. If we do nothing, I can guarantee you we'll be looking a lot more like Florida than we looked like Pennsylvania by acting decisively early on. I want to get through this, and we need to get through this quickly. This is where the virus is being spread, and that's where we need to do our work. Yeah.
You mentioned that a lot of these mitigation efforts are targeting indoor events, but as Dr. Rubin said, there's only a few more weeks left of summer. What's going to happen when it starts getting cold? Do people need to plan that they're going to keep staying outside, or will they be able to have more things inside? Yeah,
well, two things. First of all, we're trying to actually stop this virus in its tracks. And right now, because we are we have the information that we know where this seems to be spreading, we're targeting that right now. If we do that, we don't have to be as focused on this when we get into the return to school. And that's the hope, that we can actually do what we need to do now so that we don't have to, we don't want to wait another 4 weeks. Let's act now in the hopes that this makes it so that we don't have to do draconian things when we get to the fall. Yes.
This spring of the virus, the first cases appeared here, and the numbers of the cases started escalating quickly. It seemed like the overriding goal was to protect the healthcare system, to limit the virus spread so the healthcare system wouldn't be able to The last 10 days or so, the hospitalizations in Pennsylvania, according to the dashboard, have
Wait
been
there.
pretty steady. They haven't skyrocketed, they've been steady.
That's right.
So if the state's hospitals are doing pretty much okay,
Yeah.
why do a statewide measure?
First of all, the objective is to keep people safe. And one of the means to doing that is to make sure that our healthcare system, just one of the means, was to make sure our healthcare system, do everything we could to make our healthcare system not be overwhelmed. And we did that. And I think you're right. Right now, we're doing that. If we don't do anything right now, if we do what Arizona and Texas and Florida did, we're going to see that healthcare system, just as they are, being quickly overwhelmed. We don't want to get to that point. So that wasn't the goal, but it was a means to the goal of keeping people safe. So far, we've done a good job, and I think our healthcare system is in pretty good shape. We are, remember when I keep bringing this up, we were using ventilators as a reflection of how many, how many ventilators were we using compared to how many we had. We have 5,300 and some ventilators out there in the healthcare system right now. As of today, we are only using 88 of them for COVID-19 patients. Now, part of that's because the standard of care has changed. The part of it is because our healthcare capacities. We have millions of N95 masks and millions more on the way. We were concerned about gowns. We now have over 1 million, maybe 2 million gowns. We're looking for warehouse space. Hospitals and healthcare systems can't take any more inventory because they have a lot of inventory. So we have the capacity now. And I think that's a good thing. We don't want to get to the point where we were concerned back in the early stages that our healthcare system would be overwhelmed, because that would be one more reason why this virus was going to overwhelm us. We're trying to keep people safe. We're trying to keep people safe here with what we're doing right now. And part of that is to make sure that we don't let our healthcare system be overwhelmed.
Follow-up, the Associated Press reported that the county governments have received an email from your office saying that bars and restaurants that are not serving meals will be closed. Are you closing bars or ordering bars and restaurants that don't serve meals to be closed?
Yes.
Okay.
I call them nightclubs. I mean, I think if you have a place where you can go get a hamburger with a beer, that's fine. I don't care what you call it yourself. But if you're just a dive bar or a nightclub and all you do is serve drinks, that's not going to work. Yes?
I'd like to get Dr. Levine's latest assessment and perhaps Dr. Rubin's.
Yeah, why don't you pick on Dr. Rubin a little bit here, too? That'd be great.
Regarding this surge that we're seeing,
Yeah.
what is your latest assessment on what is happening in terms of the medical impacts? Are you seeing any signs whatsoever of people getting sicker or the death trend go up or
This is for both of you.
hospitalizations?
Sure.
So I'll speak briefly, and then I'm going to toss it to Dr. Rubin. So there have been some increased hospitalization rates in Allegheny County, but you have to understand that all that gets delayed, meaning you don't usually contract COVID-19 and immediately get so sick that you have to go be in the hospital. First of all, the incubation period of the virus is 2 to 14 days, on average 5 days. And then after a number of maybe a week or 2 weeks, then you're getting sicker and sicker and you end up in the hospital. And then if someone tragically might pass away, often that can be several weeks after that. And so that is what Florida saw. Florida saw increasing numbers, and then a time later, several weeks later, now that their hospital system is challenged, and then now they're just starting to see the increase in deaths in Florida. So any report, I want to clarify this, any report that the virus is less severe or less virulent, I completely disagree with. There is no evidence that the virus is less severe or less virulent than it was before. In fact, there is some genetic evidence, although it's controversial, that it's actually somewhat more contagious. That the variant that we're seeing, primarily that came from Europe, might be a little bit more contagious. But I think that we have not seen the hospitalizations because until the last number of weeks, we didn't see the numbers. Now they're starting to see some small increased numbers in Allegheny County. And we, as the governor is saying, we don't want to wait until exponential growth is going up and then our hospital system is challenged. Dr. Rubin.
Yeah, I'd like to just add a couple of things because at Policy Lab, we've had the benefit of watching the cautionary tales of what's going on in the South and other regions of this country. You know, we've worked very closely and hard to get communities reopened and keep them open, and it's been one of the an extremely common calculus is we're going to keep pushing through our gates until we see our hospitals that full, and that has been a rabbit hole. Has not worked at all. Leaders in the South have failed to recognize these increasing transmission rates. And the time for action is when you're doubling from 50 to 100 cases, not when you're doubling from 500 to 1,000 cases a day. We've also seen transmission cycles now where younger people are getting infected and then infecting older people in their community due to people being fatigued, et cetera, not distancing enough, which has been the most important strategy that we have. And that, again, delays the hospitalizations rising. And the problem that happened in Texas and in Arizona and now in California and in Florida is by the time their leaders recognized, oh my gosh, we're 85% full, they're in the thousands. And those thousands are doubling every day. And when that happens, you get overrun. So waiting for the hospitals to fill is not the way to try to use a dimmer switch. The fuse blows on a dimmer switch when you're in the thousands of your cases daily. The time for action is now, and with the urgency around school reopenings just around the corner, if we do not get community disease transmission rates down, we're really threatening the most important reopenings that we have coming around Labor Day.
Governor?
Yes.
Colonel Wolf, you said earlier that it's imperative that Pennsylvanians do their part, but just like we've seen since the beginning of the pandemic, there are people who aren't going to follow that. So what about the nightclubs and the bars and the patrons that visit those locations? Is there going to be a consequence to not doing what the order states?
Yeah, there are legal consequences. We actually have liquor enforcement officers that have made thousands of inspections and actually issued some warnings. For the most part, though, most establishments have actually done the right thing. Second thing is that I think, I don't know if you've all noticed, but more and more people are wearing masks out there. And more people are, again, I think it's like seatbelts. More and more people are saying, yeah, I don't like this any more than you do, but that virus is out to get me and I want to reduce the risk. And so more and more people are doing the right things. And I think part of what is going to happen is that people are just going to say, I don't want to assume the risk of getting this disease. So maybe instead of going to that nightclub tonight, maybe I'll stay home. And the more people who decide that, the better we're going to be. And I think that's what's happening. Right now, when this whole thing started back in March, we were in a very different place than we are now. Right now, people are wearing masks. People are actually looking out for each other in a way that they weren't just 3 months ago. And I think we're learning about, the more we learn about this disease, the more each and every one of us, 13 million Pennsylvanians, are doing the right thing. And as we do the right thing, I don't care what your economic incentive is, you're going to find it hard to remain open. You're going to be shamed into doing the right thing. Are there going to be exceptions? Absolutely. Are there going to be places that no enforcement officer has the time to go to? Sure. Are there going to be places that figure out ways to skirt this? Yeah. But for the most part, we are moving more and more in the direction where all of us are, in fact, working together to attack and defeat this virus.
And Governor, follow-up to that, what should residents do if they want to call out that person? Because that's a question we're getting in the newsroom all the time, is where can people report businesses and individuals who are not following guidelines?
That's a great question. I think individual residents, if they see something that's wrong, they ought to report it. And the more they report that, the more the people who are responsible, local law enforcement, state law enforcement, are going to do something about it. I think one of the things that happened early on is nobody was standing up, or few people were standing up, and so someone would say, hey, I'm going to be a tough guy, I'm going to stand up, I'm going to open up, this is my First Amendment right, or whatever. And it's like, I think if someone stands up and says, I don't think you ought to be doing that, you're going to be finding more and more people saying, yeah, I think you're right. I want to do the right thing here. That's what we're really aiming for. This is going to work when 13 million Pennsylvanians, all of us, decide that we want to hold on to our lives, we want to reduce risks for our loved ones, our neighbors, our coworkers, all those things. And as that happens, I think you're going to find fewer and fewer people, as we're already finding, want to violate the law.
Thank you.
Yes.
Is that me?
Yeah.
Thanks. So thanks for being here. I wanted to ask about testing. The last time I was here was in May, and that was when Dr. Levine said that one plan for the fall was to, or plans for the fall included having rapid response testing. And I was just wondering, is that still, are there still Pennsylvania firms working on that? And
No,
is that
absolutely.
likely for the fall?
Absolutely. We thought it was going to be August. I'll let Dr. Levine talk about it, but this is something we are working on. We actually have the Department of Community and Economic Development working with a specific company. We're taking a gamble here, but focused on a Pennsylvania company where we control our own destiny and say, we want a rapid turnaround test. What does it mean when you get tested and it takes 10 days to get the result? The answer is it means nothing, because within that 10-day period, you might have tested negative. By the time you get the test results back, you might be positive, but you don't know it. So we need to get a test that's easy to administer, hopefully oral, that you can do yourself, and where we get an accurate response, results within, say, 15 to 20, 25 minutes. We're not there yet. There is no place in the country that's there yet. The company we were working for originally, we thought maybe we could get it by August. It looks like they're now saying October. We're not holding our breaths, but we need to work on that, and that's the kind of testing we have to get toward.
What's the company?
It's called, am I allowed to say this?
I don't know.
I don't know.
Was it publicly bid? How did you choose the company?
That's a good question. We'll get back to you and figure out how we did that. This is one of those areas where I'm trying to move as quickly as I can, not go, wait and spend a lot of time. So I am sure if there were some things that we did that moved faster than in ordinary times, I'm sure that we did. And it is a gamble, and the hope is that it works for Pennsylvania. I'm trying to keep Pennsylvanians safe, and this is something we desperately need. Every state needs it, but we need it here in Pennsylvania. We cannot, as we're seeing right now, we cannot continue to rely on national testing organizations. Yeah.
Governor Wolf, I have two questions. One's logistically, you can answer yes or no. So even if bars have like outdoor seating, but they don't sell food, does that mean they're still going to be closed for this?
The order is, even if you're outdoors and you're serving alcohol, you have to serve food with it.
Okay, that's great. And my next question is, I know that 6 weeks from now we have that benchmark of the school year opening. And I know many teachers are concerned, thinking that they won't be safe going in the building, but lots of parents are concerned because they need their kids to go. It's obviously, I don't want to tell you,
Yes.
huge issue. Are you prepared to pull the plug on the school year in person if we don't reach these benchmarks and we still keep going up and up?
Yeah, I mean, ultimately, I don't think it's going to be me pulling the plug. It's going to be exactly what you said. Teachers not wanting to come back to school. It's parents not wanting to send their kids to school. The same thing is happening in universities. We can wave all the magic wands we want and flick all the switches we want. If they don't make individual decisions, I feel it's safe to go back, they're not going to go back. And that's why what we're doing here is so important. We need to nip this in the bud. We cannot, as Dr. Levine calls it, let it burn like Florida. We've got to take decisive action so that we have a fighting chance to be able to get to a point where parents are going to feel comfortable and confident that they can send their children to school. Yeah.
Governor, thank you. The Red Cross, as part of the testing that you all have, is now doing the antibody testing. There's a concern that those cases would come back as a positive, which means they've had COVID, now they have the antibody. Can you give Pennsylvanians an assurance that those numbers are not being counted twice as a positive COVID and a positive for antibody?
I'll turn it over to Dr. Levine too, but yeah, we actually, I think that came up back in March or April, and we are not, we understand that there are two different types of tests, but a negative in one is not the same thing as a negative in the other, and you can't conflate those things.
Sure. So first I'll answer that, and I just want to mention about the general testing. So we know exactly who has the antibody tests, and we know exactly who have had the PCR tests, and so we don't double count them. But also I want to emphasize is that any antibody test results is listed as a probable case. And so we only make decisions when we're deciding about mitigation and other factors. We're only making those decisions based upon confirmed cases, and that are only the PCR results. And so it is, and we separate it all in terms of our website. So it is apples and oranges. We're only looking at confirmed cases when we look at county case counts or regional case counts and things, when we're making any type of decision like we're making today. And we make sure that we don't double count when we look at our total numbers. I also want to mention in terms of you mentioned about the testing. So, we have reporting 28,000 tests. That's the most we've ever reported that have come back today. That's very good news that we've been increasing our testing. We've increasing our testing in terms of our community testing, but also we are testing every patient and every staff member in every nursing home in Pennsylvania, and we're working to complete that by the 24th of July. And then we're working with the Department of Human Services to test every patient and every staff member in all the other long-term care living facilities sometime in August. And then we're going to retest on an individual basis depending upon the results and then their location. And so we're very pleased with the increase in testing. We've worked with many other companies such as Rite Aid and Walmart and CVS in terms of testing. So we have a capacity to do about 1,000 tests a day at our laboratory in Exton. Those are priority tests that we do, for instance, with a priority nursing home might have some issues, and we get those back in 24 to 48 hours. The hospitals and health systems, of course, do their testing. They get those results back in 24 to 48 hours. The concern that the governor was mentioning is the national testing laboratories. So, many community tests, they're being obtained at potentially a federally qualified health center or one of the companies that has testing. They're sent to national companies, for example, Quest and LabCorp. Now, they are doing a fantastic job, but they are overwhelmed with tests now. I mean, it's particularly tests coming from California, from Arizona, from Texas, from Florida, but not only those, and Dr. Rubin could probably tell us the other states that are particularly impacted and affected. So the lag time for those national test results has crept up to a week, and then sometimes more than a week, 10 days, and that limits the utility of the results, as the governor was saying. We do have calls in to LabCorp and Quest to talk about the challenges and to brainstorm with them, but this is a national issue in terms of the number of tests that are coming to these national companies. And we'll really need a national response in terms of helping them decrease their decrease the time in terms of which we get the results.
The cases that are reported every day, can you give any kind of sense of how up to date that data is, if we're seeing this lag, and how are the lags affecting our new case counts, and is there reason to believe that case counts are really higher than they are, or will surge as we work through the backlog?
So, most of the labs are not 2 weeks, most of the test results are not 2 weeks out, but many of them are certainly within the last week. But there are concerns with that lag time. Dr. Rubin, would you like, you had talked about your concerns about the test lag time.
Well, we used to think that, wherever you were today or what you saw today in your tests, you're probably 2 weeks behind. And, with the increasing lag times and increasing reports of people waiting 7-10 days, first of all, at the individual level, it's hard to make decisions about how to get kids back to school or people back to work based on those types of decisions. And people live with a lot of anxiety. That's bad enough as it is. But from the perspective of trying to be ahead of this epidemic, when you add extra delays to the tests that we're not now seeing because of the surges in the South, that means we may be further behind than just 2 weeks. And so whatever we're seeing today, we're probably a few weeks behind what's actually happening on the ground. And that should worry us, and why we need to be a little bit more decisive and ahead of the game, if you will, in terms of responding right now.
Yes.
The 25-person indoor limit applied to religious institutions?
No. Governor?
No. John? That was actually the question.
Plagiarism. Yes.
Right now, the hospitals right now, the health systems are really making a case, like right now, to try to persuade people to come to the hospital. Do you have any, in light of what we've been talking about today, do you have any concerns about that right now?
Let me, I'll turn, let me just say that actually is a problem with restaurants and bars and retail establishments and manufacturers who want to give the people who either work there or are going to be customers or patients or students the confidence that they can come back. This is a general problem, and the problem you're talking about is one that I've heard a number of hospital executives talk about, and that is, how do we get people confident that they can come to, of all places, a hospital, to be treated for things that they might just sort of let slide and stay home. They're afraid of going to a hospital right now. They're afraid of doing so many things. This is why what we're doing here is so important. We've got to take steps to actually build that confidence that we can get back to as close to normal as we possibly can, and that's what acting decisively and early right now is. Dr. Levine?
So I would agree with the governor 100%, is that we want people to get the primary care and the other services that they need. We want people, if they have hypertension, if they have diabetes or heart disease or lung disease, to see their doctors. We want children to get their pediatric visits and to visit their family physicians. We want children to make sure they get their necessary immunizations, which is absolutely critical. So we want all that primary care and all that secondary and tertiary care to continue. We want them to feel safe to be able to go to the hospital, to have quote-unquote elective procedures. That elective doesn't always mean that it's really elective, but it's something that could wait a couple weeks but then has to be done. So we support the hospitals completely. We want people to see their physicians and their healthcare providers and to get the care that they need, which, as the governor said, highlights why it's so important to put in this targeted mitigation now, so that we don't threaten our hospitals the way Florida has, where now they can't do those, and they've started in Texas in some areas. They're starting in Arizona the crisis standards of care because their hospitals are overwhelmed and threatened. If you wait to that point, as Dr. Rubin was saying, you've missed the boat. Dr. Rubin, would you like to comment?
Yeah, a couple things. I remember. I just wanted to note that back in March and April, when I returned to my own pediatric practice, I remember being terrified. I think all of our staff were as well. Our nurses, our nursing assistants, we were worried. I mean, no one. We all felt the same way, terrified that we were going to a very uncertain environment. And then to watch what Children's Hospital did and what our health providers did to provide the adequate protective equipment, the protocols, and the decision making really helped relieve a lot of anxiety. And I think of the same way for our teachers. I feel safest when I'm at my practice right now, and Pennsylvanians should feel safe going into your healthcare systems. They've worked very hard to make it a safe environment, and their protocols are pretty impressive. But I also say to the teachers out there, our job as Pennsylvanians is to get our case transmission rates down. That's step one. To reduce the disease burden so people feel safe, and the likelihood that they're going to accidentally get infected goes way down. The second thing is to say is to have strong protocols for masking and distancing in your schools. And if you feel confident about your protocols, and with low disease transmission, I think our teachers and our staff should feel just as safe as our nurses and our nursing assistants and doctors do when they walk in the doors of the Children's Hospital of Philadelphia.
It sounds like you don't have any immediate concerns that we're headed for a capacity problem then.
The goal, as we've been saying, is to prevent that, which is why we're putting the mitigation.
I have a concern about that. If we do nothing, we are going to overwhelm our healthcare system. That's why we need to act now. One of the reasons we need to act right now. Okay, thank you.
One quick question. A lot of people in the legislature support a bill about the right to know law and it being effective, or right to know request being answered during an emergency. Earlier in the spring, you said the process, secondary was one. Will you sign that bill that the entire House approved and that is moving forward in the Senate now?
No. I think that bill has some flaws. I am for transparency, and I will stack my record of transparency up against the members of the General Assembly any day of the week. I think that particular bill has some flaws. Let's actually get to a point where we are transparent. And by the way, we are answering all right to know and open records, I think, right now. Is that right?
Will that change? Is the Capitol going to close under this new order, and so will the right to know process change? Like, will state workers be teleworking now?
To the extent they can, but I'm not sure that open records is necessarily limited by teleworking. To the extent you need to have specific concrete files, I think there's still enough people who are going to be working that can do. We'll figure out how to do that.
Wasn't that what limited it in the spring, though?
Excuse me?
I thought that was what limited the right to notice in the spring, was people were working from home, and so.
Well, we had fewer people working, period. We had more people working from home, that's true. We also had fewer people working, and that put a limit on it. We needed to figure out a way to deal with this, as we did in so many other of the processes in light of this COVID-19 pandemic. And I think we've done that now, and so moving forward, I think we should be in pretty good shape. Thank you very much.